benefit my dental fraternity friends, because you can use this as a very powerful educational tool to educate all their patients. And as a benefit to my all non-medicos friend, it is an important video where I will be showing all the basic oral hygiene tips today that you can follow on a day-to-day basis. So first of all, which brushes to use? So there are many toothbrushes which are available in the market. You have your soft, ultra soft, medium, hard, etc. But from a dentist point of view, if specifically some other indications are not there, always go for a soft toothbrush. Whatever may be the company, but always soft. No medium, no hard. Next, always 2 times brushing daily. Once when you wake up in the morning before breakfast, and the second time after your dinner is over, when you know that you are not going to have any other food. That is the time when you brush your teeth. So basically before going to bed. Why do we brush our teeth? So when after eating food or after any other action that is going on inside the mouth, there is always a bacterial buildup that is taking place on a continuous basis. So when we are brushing, we try to reduce the bacterial load as much as possible. So that is the reason why twice daily brushing is a very important advice. Next is where to brush the teeth exactly. So in today's video, this in my YouTube channel, one of the very nice videos is already there, importance of routine cleaning. So here it is shown that a patient has come for a routine cleaning, and first of all something called as a plaque indicator is being applied, a dye kind of a thing that can be seen on this video. So please zoom this video. Here in this particular tooth which is not dyed, we can see it's just a normal tooth colored substance that is there, and we do not differentiate between where exactly the bulk of the plaque is deposited. But once this dye is placed, it is applied completely well and washed off. Here the actual magic occurs. This indicator helps to indicate the exact location where there is a lot of bulk of plaque and bacterial deposits that is taking place. So from here, taking the cue, we have to understand that when we are brushing a tooth, it is not the entire place where the bulk of plaque is there, but it is mainly at this junction of the gum and tooth where the main bulk of plaque deposition is there. Okay. So next, coming on to some of the common brushing mistakes that generally patients are doing that they have reported to us. We will start with discussing a few common mistakes that my patients generally tell me when I am asking them, how do you brush? What is your routine? So one of the mistakes that they say is, first of all, they use a medium brush, or they say they use a hard brush, and sometimes they say we are brushing 3 times a day, very overzealous brushing. What happens with those is, if you are just going straight like this, or some people say that they are doing circular motion, these are random movements that is going on, and also a lot of aggressive toothbrushing. With that, what happens is, when the patient comes, we see that there is a lot of gum and tooth loss that is taking place because of excessive forcefully aggressive toothbrushing. So that should be avoided. Next, the question is then exactly how to brush the tooth. So for that, as we already discussed, that this zone, this junction of the tooth and gum zone, is the area where exactly the maximum build of plaque and deposit and tartar takes place every day. So whenever you are brushing your teeth, you have to make sure that if this is the tooth surface, the brush has to point 45 degree this way towards the gum, and there has to be some mild wiggling action that is taking place. First 45 degree angle, not 90, not 90 this way, 45 in middle, yes, and gentle wiggling motion that has to happen. Yes, this is the correct technique. Again on this side 90 degree towards the gums. Same on the upper tooth, 90 degree towards the gum. This way. Not like this, not like this. Exactly in between. And slow wiggling motion has to be there. Also, one of the things in everyday practice we have seen is there's a lot of decay and tooth problems and gum issues that occurs in the posterior part of the mouth. Biggest reason being, we mostly start by brushing the anterior part, the front part, and by the time it is actually the time to go behind, it's ideally that mindfulness is gone, or we are like, okay, chalo, ho gaya hai, and so much is sufficient. So always the advice is start from the back. Make sure that you are brushing even the last part of your last tooth, the back part of your last tooth also. Same for your upper. Make sure that you are brushing the back side even of your last tooth. Alright. And then moving on to 3-step brushing. 1, all the outside. 2, all the top part. And 3, all the inner side. The front part like this and like this. Same applies for upper one. Upper 45 degree angulation, this way wiggling, gentle wiggling, front part, top part, again not like this, not like this, 45 degree towards the gums, wiggling all the inside. So that's a perfect toothbrush for 2 minutes, twice a day, every day. Last but not the least, there is the interdental spaces, the spaces in between each tooth that is left behind. So here, by a diagrammatic representation for a better understanding, when you are holding the toothbrush, it should not be like this towards the tooth. It should be not like this towards the gum, but it should be exactly 45 degree like this, pointing towards the junction of the tooth and the gum, and slight wiggling motion. Last but not the least, we will move on to the last part of the video, that is interdental space. So here when we are looking, we have cleaned this part, the top part and the inner part. What about this front and back portion where both teeth are touching each other? We never mentioned about that. So that is the interdental area, and even that needs cleaning. For cleaning your interdental area, first of all what we have to do is, this is a dental floss. It's available in any pharmaceutical shop. So here we have to take a generous amount of the thread and wound it onto our index fingers. Alright, and holding onto it under control. This is how we go in, gentle wiggling, again gentle wiggling on the other side, and we come out. Again same, we go in, gentle wiggling, wiggling on the other side of the tooth, and we come out. So I know that showing on a model is easier than the actual practice on a day-to-day basis, but if you can try to do it even twice a week, mainly when after most fibrous food is ate and a lot of it is stuck in between our tooth, it will greatly help in managing our dental health. So here I will show you how to use one more very powerful tool to clean the area in between tooth. So the first one is, it is called an interdental toothbrush. It looks like so. It has a tiny bristle-like part at its terminal end. It comes in two varieties, as a normal space and the wide space. So depending on which patient requires which variety, we generally prescribe so. So here how it is used is, very gently it is placed in between two teeth as shown, and front and back motion is used and then taken out, so this area gets completely cleaned. So now I will be discussing about a few toothpastes that are advised by the dentist and that are not. Neither I am promoting any particular brand or am against any, but uh, for example, Patanjali's Dankanti, it has a lot of abrasive in it, so it causes a lot of sensitivity in patients, so it is not advisable. Coming on to Vico, also similar to the other one, the components are not standardized in nature, so not advisable. This one also a very popular brand, but it has a lot of artificial sweeteners as well as a lot of artificial colors in it. So again, not advisable from a dentist's point of view. For patients who has a lot of sensitivity, this particular toothpaste is very well accepted by the patients, and they have come back with very good review that they have got a lot of relief from that sensitivity. So Vantage Foot is advisable from a dentist point of view. For a regular use, Colgate Total is advisable. It helps with the healthy gums as well as healthy teeth. So yes, advisable. Also, special edition, some patients ask that what is a advisable toothpaste for kids. So Kidodent, this is the one, less than 5 years, just even less than pea size amount with a small kids toothbrush. This is advisable from a dentist point of view. So that's about it for today. Do let me know how you like the video, and also if you want any specific topics that you would